You've been continuously funded by the NIH over the last 25 years for your research programs. You're also the co-author of the fourth edition of Successful Grant Writing, Strategies for Health and Human Service Professionals. How has the grant writing field changed over the last few years, and how does this new edition address these changes?
First of all, thank you, Dara, and thank you for this opportunity to talk to your readership. I've been funded continuously, as you mentioned, for my research programs. So I've seen the field of grantsmanship as it's evolved. And I would say, one of the biggest changes has been that lack of monies that have, or the dwindling of funds available for research studies, which poses a significant challenge to researchers and grant writers. So that's one of the biggest changes. But having said that, it's important to note that there is still money for innovative and novel and exciting research studies. And that if you don't apply for a grant, it's a guarantee that you won't have the opportunity to get funded. So funding levels are a great concern, and therefore it's become very competitive, more so than in previous years. And so it's very important that researchers and faculty and grant writers pay much more attention to the grant writing process than perhaps even 10 years ago was necessary. So in addition to those changes, the other big change of that in the past couple of years, all grant writing submissions, all grant application submissions, I should say, have become electronic. And this has made grant writing easier in some respects, and also poses new and additional challenges. So not only does the person writing a grant have to be careful about the application deadlines, but they also have to be familiar with the deadlines internal to their institution for uploading their grant. And so the uploading of grants to electronic and databases that then are fed to the NIH and or other funding mechanisms is a very big organizational change for the grant writing world that has posed some interesting positive challenges. The other, I think, big change in the NIH world is its criteria that's applied for scoring grants. And the community is learning how best to score grants and what the scores actually mean. So this is an evolving area. And then, of course, the other change related to changes in scoring is the increased emphasis on novelty and innovation and public health broad. So obviously, the change in criteria has to be considered in thinking about one's project, and may affect as well the write-up of a particular application. So I would say those are the biggest challenges, or changes I should say, in the grant world in the last couple of years.